Hi students, today you are going to learn about the scapula. There are two scapula, one on the right side and one on the left side. So scapula is an example for the flat bone. Where it lies? It lies on the posterolateral aspect of the thoracic cage. So this is the thoracic cage. Okay. So posterior to the thoracic cage as well as lateral to the thoracic cage, the scapula is present. So the location is, it is located on the posterolateral aspect of the thoracic cage. So this is the right side of scapula, and see this is the left side of the scapula. Coming to the side determination points, what are the points to say scapula is a right side or a left side? So first point here, this is the dorsal surface of the scapula. It should faces dorsally or posteriorly. Then this is the costal or ventral surface of the scapula. It should faces ventrally or anteriorly. Then you have here as an inferior angle of the scapula. It should directed downwards or inferiorly. Then this is the lateral border of the scapula. It also faces laterally. Then here is the glenoid cavity or glenoid fossa. It should also faces laterally. So these are all the points for side determination. Here is the left side of the scapula. Glenoid cavity is facing laterally, whereas the lateral border of the scapula is also facing laterally. Inferior angle of scapula is projecting downwards or it is facing inferiorly. The dorsal surface of the scapula is facing dorsally or posteriorly, and here is the ventral surface or costal surface which is facing anteriorly or ventrally. So why it is called as costal surface? It is relating to the ribs. Ribs are also called as costal. Let's move to the features of the clavicle. So clavicle has two surfaces. The surfaces are dorsal surface, then costal or ventral surface. So this costal or ventral surface, it should be anterior and it is relating to the ribs. That's why it is said to be the costal surface. And this is dorsal surface. The dorsal surface, it should faces posteriorly or dorsally. So it is called as dorsal surface. So dorsal surface appears to be convex in nature, and ventral or the costal surface which is concave in nature. So coming to the dorsal surface. So dorsal surface is now divided into two fossa. The fossas are supraspinous fossa, which is a smaller fossa lying above the spinous process. So it is called as supraspinous fossa. And below larger fossa which is called as infraspinous fossa. Why? Because it lies inferior to the spinous process. So it is called as infraspinous fossa. So entire dorsal surface is divided into smaller supraspinous fossa and larger infraspinous fossa. So now these two fossas are connected by one notch. This notch is called as spinoglenoid notch. Why it is called as spinoglenoid notch? It is lying between the spinous process and the glenoid cavity. So it is called as spinoglenoid notch. So through this notch, the two fossae are communicated. Then costal or ventral surface, which is concave in nature. So it has presence of 4 longitudinal ridges. So here it is a first ridge 1, 2, 3 and 4. So these are all the elevations which are produced by the muscles. So these elevations are called as longitudinal elevations, or you can say it like a longitudinal ridges. There are 4 in number. So surface is over. So now coming to the borders of the scapula. The borders are the lateral border, the medial border, then superior border. Lateral border, medial border and superior border. So superior border is very thin if you feel, and medial border is also very thin, whereas if you feel the lateral border, it is appears to be very thick in nature. Lateral border, it is appears to be very thin, lateral border which is appears to be very thick in nature when compared to superior border and medial border. So now this lateral border, it is extending from glenoid cavity till to the inferior angle. So lateral border extends from glenoid fossa till to the inferior angle of scapula. So medial border extends from superior angle to the inferior angle of the scapula. So this is the medial border. Now coming to the superior border is a very short border. So close to the coracoid process of the scapula, there will be a notch is present. This notch is called as the suprascapular notch. Suprascapular notch which lies close to the coracoid process on the superior border. So this is suprascapular notch and this one is the spinoglenoid notch. So borders over. So now let's move on to the angles of the scapula. So angles are three angles. This is superior angle, here is the inferior angle, and this is the lateral angle of the scapula. Superior angle, inferior angle, this is the lateral angle. So in the lateral angle only we are having the presence of glenoid fossa or the glenoid cavity. And superior angle, it lies between the superior border and medial border. Inferior angle lies between medial border and lateral border. And this lateral angle where the glenoid fossa is present, right? So that it should be facing laterally. So lateral angle should faces laterally. Lateral angle should faces laterally. So surfaces over, borders over, then angles over. So if you see the glenoid fossa, so it has a margin of glenoid fossa, or you can call it as the rim of the glenoid fossa or glenoid cavity. So if you see just about the glenoid fossa, there is a tubercle is present which is called as supraglenoid tubercle, this one, supraglenoid tubercle. And just below to the glenoid cavity, there is another tubercle is present which is called as infraglenoid tubercle. So supraglenoid tubercle and infraglenoid tubercle. So surfaces over, borders over, angles over. Now coming to the processes. The processes are two processes. One is coracoid process and another one is a spinous process, and third process which is called as acromion process. Coracoid process, spinous process, acromion process. So now first we will go to the coracoid process. So coracoid process, it is projecting slightly laterally and as well as forwards. Coracoid process which is directing laterally as well as forwards. Now coming to the spinous process. So spinous process is having two lips and one border. The lips are upper lip of spinous process, and this is the lower lip of spinous process, and it has one posterior border. This posterior border is called as crest of spine of scapula. Crest of spine of scapula. Then coming to the acromion process. So acromion process has two surfaces and two borders. Surfaces are superior surface and inferior surface. Borders are lateral border and medial border. Lateral border and medial border. So if you see along the medial border, there is one presence of a facet. See this? Facet is there. So this is for the articulation of the clavicle, where it forming an acromioclavicular joint. So on the medial border of the acromion process, there is a presence of facet. This is for the articulation of lateral end of the clavicle to forming a joint called as acromioclavicular joint. So that finishes the scapula. So, we have two scapulae here. This is right side scapulae and this is left side scapula. So, the points are inferior angle should directing inferiorly or downwards like this. Then lateral angle of the scapula, it should be directing laterally, and lateral border of the scapula is also directing laterally, whereas dorsal surface, it should faces dorsally like this, and this the costal or ventral surface, it should be facing ventrally or anteriorly. So, that finishes scapula.